Sharp and cutting needles have been used for 70 years.
Pourquoi on est arrivé à ces aiguilles? Parce que entre cette aiguille qui coupe et qui est pointue, qui passe à travers la peau,
Why did we come to these needles? Because there is another way to inject that is more surgical and that implies using cannulas.
Il y a une autre façon d'injecter qui est une façon plus chirurgicale, qui est l'utilisation des cannulas.
Cannulas are similar to sharp and cutting needles because they are stiff. There is a large caliber stiff tubes. In the beginning, you had to make a hole with a bisturi in order to make an injection. Then introduce the cannula that will go into the skin in a rectilinear way. Magic needle is the complete opposite. It's flexible, not sharp, not cutting. It's rounded at the end, so it's not a needle because it's capable neither of incising or cutting the skin. It's a concept opposite to that of the needle. In the beginning of 2008, we had the chance of using the first flexible needles. When we used them for the first time, we were surprised to find them sliding so easily, which is why we call them magic. We had never imagined it would be so easy to make a needle slide under the skin.
Dans notre domaine de l'esthétique,
we can more easily inject products in a larger amount and without ecchymosis, while being less invasive and almost painless.
Moins douloureux, en tous les cas beaucoup moins douloureux pour les patients.
The risk of inducing ecchymosis while using a pricking and cutting needle amounts to almost 1 time out of 2, maybe more. Now the risk goes down from 50% to 4.7%, which is close to zero. We now have a less invasive technique that is more bearable by patients. At the moment this intervention, which may look upsetting, is done, a certain amount of anesthetic product has already been delivered. Consequently, making the needle swivel and slide in the other way round is not painful. Keep in mind that the needle is not sharp and does not cut. If you try to make an incision in the skin with it, you will not succeed. It can only slide. This needle is flexible, and it's the quality of flexibility that we should exploit. You have to maintain your other hand on the skin and pull it so that the needle can slide under it. The more you stretch the skin in the opposite direction, the more the needle will slide at a superficial level and then will go back up. The existence of these flexible needles have given birth to another way of injecting. We diffuse the product as a coating. We succeed in constructing a coating under the skin, rebuilt like an underlayer under the papillary dermis. The skin regains shape and volume, looks more supple. Using and mastering this technique enables us to do it in one session, what we used to do in several. This injection technique has a strong asset. It is easier and less painful to inject. It makes the work easy. It is now possible to inject elbows and knees, all the areas of the body the patient will feel like giving back life or moisture.
D'hydratation entre guillemets de la peau.
This new technique should be used to improve the results of injections. You know, word of mouth is crucial, and patients can hear people talking about this technique, and they know that it is now possible to inject more product in one session with better results. Regarding filers, the greatest demand is to treat nasogenian folds. In fact, this name is not appropriate. People should talk about nasolabial lines, as these lines start from the nose and go to the mouth. This is the area young plastic doctors learn to treat first. I make a small hole with the normal needle here. Then I introduce the flexible needle and deposit a small drop of product that also anesthetizes, and it contains anesthetic product. and I slide the needle, it's painless, does not hurt. At the beginning, when we were using this needle, we started injecting from the bottom of the line. In fact, it's also more difficult to inject from the bottom to the top. We learned from practice and sharing with colleagues. Finally, it was obvious to us that the best starting point for injection was the upper third of the nasogenian fold. This position is the best to inject correctly the fold, properly deposit the product in the most hollowed part of the line, which is the area close to the nose, and then slide back the needle in the labial area while keeping on injecting the product all the way back into the nasolabial fold. This time the needle is of smaller. When this intervention that may look upsetting is done, some anesthetic product is already delivered at the line level, okay? And then making the needle swivel and slide the other way around is not very painful, because you have to keep in mind that the needle is not sharp and does not cut. Otherwise, it could not move forward. If you try to insist the skin with it, you won't succeed. It can only slide. You are going to feel strange sensations in your lips, as there is an anesthetic, okay? To put correctly the product in the most hollowed area, next to the nose area, is the best position for injection. Even for the small area, like here, I spread the product like a coating, in the hollow, just under the nose. The first part of injection consists in spreading the product all over, drawing the shape of a fan, in the nose area, toward the nose. The second part concerns the labial area, injecting in the direction of the lips, going down from the top to the bottom.
The diameter of the needle used to make the incision is similar to or slightly larger than that of the Magis Needle. The incision should be made only by using the needle's beveled edge without inserting it in depth. The points of injection are located at the upper third of each nasolabial fold, which provides easier access to the high and low part of the fold. This position for the point is better than a lower position. The required injection technique corresponds to a retrograde method with the maintaining of the cutaneous area opposed to the direction of the needle. The injection of a high viscosity product is subcutaneous. When treating nasogenian folds, the use of a 27-gauge needle is recommended.
So we will try to correct this a bit and move the cheekbones back up. It's true that a cheekbone treatment is very indicated for this man. The area we call the tear-through is this area. As the fat of the cheekbones melts, lines are growing, like a hollow. It's a normal change of the face. But the melting of the cheekbones fat makes this area progressively collapse. So the injection point is situated in this area, in order to have access to the upper part of the cheekbone and tear-through. Here, I draw a small landmark, it's the gravity line. I inject the product under the skin. If you rebuild this area, your face will catch the light differently, and you will look well again. We take out the needle and block it on the system. We check that the needle is therefore set well. Then we press on the plunger to make wring out the product a little. Here is the product goes out a bit fair at the end of the needle laterally, and the syringe is ready. Therefore, I introduce the needle vertically. Here we are. It's perfect. I inject a small drop of the product, and then I hold the skin and swivel my needle. Always manipulate and inject with care. I always have to hold my hand like this to maintain the skin properly. The second part of the intervention consists in injecting while removing softly the needle. The particularity of this injection is to start from one point, and then to swivel the needle, drawing like a fan technique. So you change direction each time.
The diameter of the needle used to make the incision is similar to or slightly larger than that of the magic needle. The incision should be made only by using the needle's beveled edge without inserting it in depth. The point of injection is located on the vertical line that goes down from the external canthus to the intersection with the tear-through. The required injection technique corresponds to a retrograde method which consists of maintaining the cutaneous area opposed to the direction of the needle. The injection is subcutaneous and can be deeper when approaching the orbital rim of bone. When treating the tear-through, a 25 gauge needle is recommended.
We are going to treat the commissural area and the facial contour of the face. This is one of the areas we most frequently treat on a major point of dissatisfaction for many patients. In fact, I position myself at the opposite side of the area to treat, and I introduce the needle in this direction. I make a small hole to inject just on the chin fold. We have searched quite a bit before finding this specific point, because there is a large number of veins on the sides we have to avoid. We experience many options to inject under them, around, on the sides, or laterally, through the lower part of the chin, and so on. As we kept on trying, we found that this point was really the best one to treat on the commissural area. Using this point of injection under the chin fold really enables to work on the area at a global level. As you spread the product in several directions, you treat the chin, the oval, the commissural area, and even the lip corner. We use a 27 gauge. So, from this point, I can easily go down in the oval and in the commissural area as well. I inject a lot of product because I want to erase the shadow caused by the hollow between the chin and the cheek. Everything is a question of light in your face. By reducing the shadow, you add light to the face, and by adding light, you look younger. Treating the chin is always a bit painful because this area is very fibrous. I said earlier that we were treating the oval as well as the commissural area and the chin to remove the small and visible central lines. Focus on the difference between these two areas. This one on the right is injected, and the one on the left is not. Look at the shadow. The hollow here and the hollow there. Please turn a little bit to me. Here we are. We will do the same thing, just a small hole, precisely into the fold.
The diameter of the needle used to make the incision is similar to or slightly larger than that of the magic needle. The incision should be made only by using the needle beveled edge without inserting it in depth. The injection points are located on either side of the face in the chin fold to treat both the chin and the commissural area. The required injection technique corresponds to a retrograde method, which consists of maintaining the cutaneous area opposed to the direction of the needle. The product injection takes place in the middle layers of the dermis. When treating the commissural area, a 27 gauge needle is recommended.
The jugal wrinkles refer to the cheeks. In French language, jugal and cheeks have the same linguistic root. It corresponds to the wrinkles that cross the cheeks. They are most of the times caused by a beginning of heliodermy. Heliodermy means the skin loses its elasticity, becomes thinner and more sensitive. It also bleeds more easily. If you scratch the skin suffering from heliodermy, it bleeds immediately. Heliodermy often increases the intensity of cheek wrinkles. Here, I'll have to make several small holes, but as they are very small, people cannot see them. They are small and superficial. Not even one small drop of blood is coming. I position my needle differently, with a rotation of 45 degrees from the continuous surface. I also choose a direction. I keep this direction, which makes the injection easier and less painful.
Ça risque de faire des bleus plus facilement parce que
the most important risk is to cause bruises, because the layer of the skin is thinner. There is no other risk, on the contrary. It is a zone where the skin is thick enough, which enables to make the needles slide easily.
Facilement, ça présente pas de particularité. C'est un traitement de la peau. C'est plus un traitement de la peau qu'un traitement des volumes ou un traitement de la ride elle-même.
It is more a skin treatment than a volume treatment or wrinkles treatment. The product is injected more superficially, so that it penetrates the superficial dermis.
Qui nécessite le remplissage au niveau de la peau.
Donc là, les injections qu'on fait, c'est pas seulement des injections pour faire du volume, mais c'est...
These injections are not used to give volumes, but also to revitalize and moisture the skin. As the injections are made superficially, we have to use a low reticulated product suitable for the superficial injection.
Un peu souple qui permet l'injection superficielle.
Besides, if you compare it with the other techniques, you can notice that the bruise appears immediately. It happens inside, in depth, even though it's superficial.
Cette zone malade de la peau, au niveau des...
The sick area of the skin at the cheek level requires more superficial injections. Thinner needles are used. Do you know that the colors of the needles are corresponding to the colors codes? For example, all the 30 gauges needles are yellow. We also use a low viscosity product that enables to inject softly these wrinkles. Despite all this, small ecchymosis can appear when injecting the jugal wrinkles.
On fait quand même des petites ecchymoses en injectant ces rides jugales.
Normalement, ça devrait pas faire mal.
Normally, the jugal area does not hurt, as it's not a sensitive area on the face. But when you see such wrinkles on the cheeks, it means there is a little bit of fibrosis underneath, and fibrosis prevents the needle to slide easily. Then it hurts a little bit.
Donc ça fait un peu mal.
The diameter of the needle used to make the incision is similar to or slightly larger than that of the magic needle. The incision should be made only by using the needle's beveled edge without inserting it in depth. Points of injection are several and located at the ends of the wrinkles so that all the area is treated. The required injection technique corresponds to a retrograde method, which consists of maintaining the cutaneous area opposed to the direction of the needle. The injection of low viscosity product takes place in the superficial layer of the dermis. When treating the cheeks, the use of a 30-gauge needle is recommended.
From my opinion, the second and most remarkable area is the lip area and the remodeling of the lips.
Les techniques qu'on avait précédemment pour injecter les lèvres, c'était des techniques qui étaient invasives.
The techniques we used before were invasive and painful and causing hematoma and ecchymosis.
À mettre en pratique.
These techniques were difficult to practice, requiring truncular anesthesia. This is the same type of anesthesia used by dentists. It means a deep injection of anesthetic product, which is interesting because it makes the pain disappear, but the patient can no longer move her lip naturally. So in order to correct the lips, it's better to keep the natural lips movement, to check her natural way of moving. We'll start with the left side. I will make a small hole precisely at the corner of the two lips. I introduce our needle in the small hole. It does not sting, but slides, and I inject under the skin. In our product, there is a small quantity of anesthetic, so you do not feel the product at all. Here I am. I deposit a small drop of product. I inject very progressively, precisely, at the point of the corner of the lips. As you can see, it does not move forward, so you have to put the first finger here and then put it like this. Then it slides more easily. We do not put anesthetic before injecting because we count on the anesthetic effect of the product. So I introduce the needle and make it slide all along the lip edge without anesthetics. This was not conceivable before. In this case, the important point is to use the 27-gauge needle. It is great because it slides along the edge and provides the perfect lip restructuration. It's almost impossible to practice the same gesture with a beveled cutting needle.
C'est quasi impossible de pratiquer.
Peribuccal wrinkles are almost removed. I make a small hole here. You can see how the needle is thinner. It slides on a much more superficial level than the other needles. It acts more and more on the dermis than on the volume. Go on, keep smiling. Pull, pull, pull. Here we are. Okay, let's say 90% improvement. It worth it, wasn't it?
The diameter of the needle used to make the incision is similar to or slightly larger than that of the magic needle. The incision should be made only by using the needle beveled edge without inserting it in depth. The points of injection are located at the corner of the lips. The required injection technique corresponds to a retrograde method which consists of maintaining the cutaneous area opposed to the direction of the needle. The injection of the product can be done in the white line of the junction of the red lip with the skin, as well as in the labial pulp. The peribuccal area is treated more superficially. When treating the lips, a 27 or 30 gauge needle is recommended. A 30 gauge needle is recommended for treating the peribuccal area.
For me, this is one of the most difficult faces area to treat because there are some risks. That's why it's important to find the exact point of injection. First, I make a small hole in the skin at the level of the eye angle. Here, but under the orbital rim. Using this point, I introduce the needle and slide it under the dark circle. Then I inject the product very slowly while removing the needle. It does not hurt at all. It slides, it's not sensitive, and it's very efficient. It took time to find the appropriate injection point. After trying different positions, I think that the best position is just inside the orbitary rim and the eye angle, which allows to slide under the dark circle, both on the outside and the inside.
Qui permet de glisser sous la cerne, à la fois sur l'extérieur et sur l'intérieur de cette cerne. Il faut bien se positionner.
So you have to find the correct needle position to avoid all the small veins. I position the needle vertically, and as it's not sharp, it does not sting. The patient almost does not feel it. With the flexible microcannula technique, dark circles can be treated softly. You introduce the needle and you can inject the product without causing ecchymosis or hematoma without specific risk for the patient. Here, we're not at all on a superficial level, but at a certain depth. There is a little quantity of anesthetic in the product's formula. That's why patient does not feel the product. And I gently slide my needle. I slide. Here it is. It slides gently, and I deposit a small drop. It is necessary to go slowly, otherwise the product spreads over in all directions, which is not good. High viscosity products are used. They are injected in the depth into the dark circle, so that it raises the level of the skin. The shadow then disappears and the skin catches the light better.
L'ombre disparaisse par la nouvelle prise de lumière qu'on a en traitant cette cerne. Dans le choix de l'aiguille, évidemment,
of course, we use a 27 gauge flexible needle, which is flexible enough to position itself more easily in the area we want to treat. It goes relatively in depth. We try to go through the edge of the bone, the rim of the bone that follows the dark circle as much as possible.
Patient standing, the point of injection is located at the convergence of two lines, one going down vertically from the external canthus and the other diagonally slightly above the orbital rim. The diameter of the needle used to make the incision is similar to or slightly larger than that of the magic needle. The incision should be made only by using the needle's beveled edge without inserting it in depth. The required injection technique corresponds to a retrograde method which consists of maintaining the cutaneous area opposed to the direction of the needle. The injection must be deep in order to pass along the rim of bone. When treating the dark circles, 25 or 27 gauge needles are recommended.
Let's talk about the facial remodeling, because that's finally what we're doing. in the approval study I did with the doctors and surgeons, we noticed that the more you control the injection technique, the more you easily inject, and then you naturally inject more product for the same patient.
Naturellement, plus de produits pour la même patiente.
It is then essential to disinfect, to aseptize the skin and correctly apply an antiseptic product. I will place the injection points by drawing small circles on the skin so I can see the skin. From this point, using this point, I inject like this, and from this other point, I inject like that to remodel the cheek. Then, right away, I make the point of the glabella. First and quick assessment. The fact to use and control this technique enables to get it only one session. The result we used to get in several sessions. I think that asset, the advantage of this injection technique, is that we can inject more product more easily with less pain for the patient, less bruises, less hematoma. It then makes the work easier because we can inject several syringes.
C'est plus une réalité qu'avant parce qu'on a cette possibilité de le faire. On a des produits qui sont merveilleux maintenant parce que hyper bien.
We now have great products. They are much better tolerated. Our technique is less invasive than before, more bearable. The gesture seems to be more important than before, but less aggressive. The risk of making an ecchymosis with a cutting and sharp needle is twice more important, perhaps even more than twice. First, I'll start injecting here, madam, in the area named the glabella, after the cheeks and the back of the cheeks. Afterwards, we will be able to inject the lips, the nasogenian folds, and the commissural area. It is possible to reduce the wrinkles depth by injecting hyaluronic acid inside. It is necessary to always make the central point because veins are going through laterally. You put the point at the middle and you slide the needle under the vein. Here I am exactly in the small hole. I put a small drop so that doesn't hurt. I always use the flexibility of the needle to slide into the skin. It is always more difficult to inject from the top to the bottom than from the bottom to the top. So you always must stretch the skin. It is always the same idea. We apply and spread the product so that can diffuse itself in the subcutaneous area, like a coating. In most gestures made here, we don't make any ecchymosis, whereas before we put the needle at one point, then inject the product. Come out, re-inject, re-come out again, re-inject. So it was nearly sure to make an ecchymosis. Now the risk has been reduced from 50% to 4.7%. It means nearly zero risk. The traditional technique for hands is to make a hole between each hollowed area of the metacarpus and to introduce a rigid cannula, like this one. It's painful. It requires anesthesia. The magic needle technique is completely different because it enables to go softly through the skin, injecting the product. To treat hands, there are different protocols. We make two holes in the same level. One on each side. We always avoid veins because we'll go under the
Les
vein.
veines, parce qu'on va passer sous la veine, en fait. On met un peu de produit au départ.
First, we inject a little quantity of the product. We unstick a little bit the skin so that it can slide more easily.
Voilà, ensuite, ça glisse tout seul.
En positionnant la façon d'injecter, on glisse sous la peau, mais
We position the needle under the skin and inject the hyaluronic acid as coating, as American and Anglo-Saxon people say. We're realizing a coating, like a new layer under the papillary dermis.
on refait une espèce
The skin regains shape and volume and looks younger.
Et donc ça redonne ce galbe à la peau un plus jeune qui a de la souplesse, etc. Et les mains, c'est vrai que c'est une des plus belles indications de l'utilisation de ces aiguilles souples. Parce que vous avez vu, il y a
It's true that the hands treatment is an excellent indication for using these flexible needles because, as you have seen, it's painless and not invasive. It is now indicated for treating some areas of the body, meaning that we can now inject elbows and knees and any part of the body the patient would like to re-give life and moisture to.
on a envie de redonner un peu plus de vie et d'hydratation, entre guillemets, de la peau.
The diameter of the needle used to make the incision is similar to or slightly larger than that of the magic needle. The incision should be made only by using the needle's beveled edge without inserting it in depth. 2 injection points are necessary and located on a transversal median line. Their position should be chosen in order to cover the entire cutaneous surface. The required injection technique corresponds to a retrograde method with the maintaining of the cutaneous area opposed to the direction of the needle. The injection is subcutaneous and should pass under the dorsal venous network of the hand. When treating the hands, the use of a 25 or 27 gauge needle is recommended.